So the question, will you still love me tomorrow? And it's framed as a question to someone in our human experience who loves us. I frame it this morning in the question we have of God. Will you still love me in the morning, tomorrow, after all of this? In the story of Jacob was left alone, and a man wrestled with him, a man that we will be led to believe was God in human form. But I would suggest that the question remains, even today, who was that? What was that? You see, Jacob was afraid of the future. Jacob had isolated himself for his own safety and to protect his own family. The one who would wrestle with him met him in his fear, in his isolation, and in his separation. Now that's a familiar story for all of us, and particularly for our medical and healthcare professionals since the onset of the coronavirus pandemic. You may not know this, but there are about 50 of our members here at Clifton United Methodist Church who are physicians, nurses, public health officials, patient care aides, medical administrators, EMTs, researchers, counselors, therapists, and students in those allied medical fields. Meet a few of them who have been wrestling with God. You may not recognize them in their masks. Let me just say some of their names so you can look for them in the pictures. Dr. Andrew Lavick, Dr. Mark McCauley, Dr. Tom Berger, nurses Mindy Allen, Lynn Ahrens, and Chris Haskell, and pharmacists Angela Haskell and Keith Allen. And in different measures, they have found themselves alone, like Jacob, fearful about the future, yes, isolated for their own safety and their patient's safety, and isolated to protect those they love at home. Hear about it from Mindy Banks Allen, who's been a nurse at the quarantine shelter where persons who are homeless and positive for COVID-19 wait out the infection.
Hi guys, so during the pandemic, I've been working as a nurse with Cincinnati Health Department. About half the time this summer I've worked remotely from home doing contact tracing. The other half the time I have worked at a quarantine shelter in Over the Rhine, where we've had patients that were either tested positive or waiting for results to come back before they could go back to the shelter they usually stay at. It's been hard, I won't lie, because I just want to be home with my family and keep them safe. But when I signed up to be a nurse, I knew that I would have to step up in a situation like this, and I just hope that my family understands that all of the time, and please keep us in your prayers, and we're definitely praying for all the other medical staff. Thank you.
Mindy's deep questions about her vocation, the sacrifice she's making for her family and the sacrifice of her family, and the difficulty of her work sounds a lot like a wrestling match to me. Much like the wrestling match between Jacob and the one who wrestled him all through the night. Janae Clark's work as a hospice nurse It illuminates the aloneness of her hospice patients, separated from their families, and the fearful isolation of their loved ones who are separated from the people they love at the liminal time of death. Janae wrestles with how to care for her patients and their families and help them, while at the same time rearranging her whole world simply to keep her home and the people she loves protected from the disease and the risks of her workplace.
Hi, it's Janae. I'm a hospice nurse, and some of the unique challenges I face right now has to do with the fact that I can't go anywhere to do my charting, and so I have to come home, and that requires a whole decontamination shower process. And so there are days where I take 1 shower, 2, 3, and sometimes 4 showers with 4 driving back and forth. Which just adds time onto my day, and I might still be charting at midnight because of all the extra driving and charting them doing because I can't go anywhere. The other stress has to do with the family separation. Sometimes I have these families that haven't seen their loved one in months, where they were walking and talking and coherent before then, and now they're ready to die in the next 12 to 24 hours before the facility lets them in, and they're comatose and can't talk, and the family really doesn't get a chance to say goodbye. And seeing that heartbreak for the family is really, that's what's rough. Those are the stresses unique to my job. As far as what's really helping me, I do have a really supportive home system. Rich does all the cooking and the cleaning and the laundry and sanitizing the house, and so he's really good at that. I also don't have little kids at home that I'm trying to worry about school and homeschooling and all that, so that's helpful. But also I think my job, that I made the switch to hospice right before this pandemic hit. I had a very non-supportive environment before the pandemic, but my managers, my coworkers are just so wonderful and supportive, and that has helped me deal with the stress.
The thing about these kinds of wrestling matches that Mindy and Janae are illustrating, and the one in the story of Jacob, is that these are uninvited wrestling matches. Right? Jacob didn't invite someone to come and wrestle all night. No. In the midst of Jacob's questions about self-identity, about vocation, the adversary showed up uninvited. Perhaps a little like a coronavirus. Our medical professionals confront the same. This is an uninvited wrestling match. Yes, it impacts them personally and relationally. But at another level, it has cultural and systemic implications. S.C. Morgan, a physician, wrestles with the cultural dilemmas that fueled the transmission of the virus and the impact of that on an overwhelmed and depleted healthcare system.
The views expressed are my own. They are not those of my employer. I'm a pediatric rheumatologist, a doctor to children with autoimmune diseases such as juvenile arthritis and lupus, and many of my patients are on medications that suppress their immune systems. The impact of COVID on my clinic is that we have more telemedicine visits and less in-person visits for infection control reasons. There is concern that some patients may not be getting all the medical care that they need right now. And also, people are losing jobs and insurance and may not be able to afford treatment. Families are thus experiencing an increased sense of vulnerability right now, and it's urgent that we take all measures we can to stop the pandemic. So when I see defiant crowds shunning masks and saying that to not wear a mask is a God-given constitutional right, it makes no sense to me. I do not see in the Bible or the Constitution that there is a right to harm the innocent. I've even seen a video of a politician invoke the dying words of Eric Garner and George Floyd and say, "I can't breathe," before dramatically ripping off their face covering. as if to say that wearing a mask to reduce the spread of the virus was an infringement on par with the unjustified taking of a human life on the basis of skin color. I find this so sad and infuriating. Such behaviors of not wearing a mask and not socially distancing result in an overwhelmed and depleted healthcare system. Emergency and intensive care systems and personnel are exhausted. Healthcare workers are, after all, human, and they suffer from the toil of caring for those dying, often alone and cut off from their families, when as a society we could be taking simple steps to avoid this pain. What I do see in the Bible is a commandment to not kill, and that we are to love our neighbors as ourselves. So wearing a mask is one way to do this. Some infected people have no symptoms at all, and by not wearing a mask, they may spread the virus, resulting in the sickness or death of another person, maybe even a loved one. Spreading the virus is hurting the economy and the education and development of our children who are deprived of enriching learning environments and social interaction. So, I gladly put on the mask, knowing that I am loving my neighbors, myself, my country, and safeguarding the health of my young patients. Please pray for the health and restoration of healthcare workers and for the soul of our society. Thank you.
Thank you, Mindy, Janae, and Essie. The greatest thanks we can give, we commit to give. Of wearing our masks, of keeping our distance, and washing our hands. And my first wrestling adversary was my brother, 15 months older than I, and then my cousins. I learned early and often that you can't wrestle in a socially distant way. As John Acuff on the cover of the bulletin suggested, to wrestle the other person has to be close to you. It's a very intimate, personal activity. We see exactly that in Mindy, Janae, and Essie's stories. In this moment, when all of us are feeling the intensity of aloneness and separation, and in this moment when we are afraid about what the future holds, could it be that God shows up to wrestle us, unasked, unbidden, uninvited? Yes, indeed. That is the gospel message. The message isn't that you don't have to wrestle. The message is that God comes to wrestle with you. We'll look back on this season that we're in the midst of, and we will see this wrestling match of the entire human community wrestling with God about life itself. God comes uninvited into that, grabs a hold of us in our loneliness, in our isolation, in our protection, in our separation, and in our fear. God grabs a hold of us to wrestle with us. And you know I mean that in a metaphorical way. But sometimes the tossing and turning at night feels like real wrestling. Like Jacob, we shall wrestle with God too, because our questions matter, because our self-identity and vocation matter, because our questions about science and faith matter, our concerns about community and other people matter. Right now, the medical community, these amazing figures we've heard from, and those we haven't heard from, and many, many others, are wrestling God for all of us. It is our collective wrestling match, and it's our personal one too. It will be intimate. It will be a tangle of arms and bodies, like on the cover of the bulletin. It won't be pretty. It won't be easy. We won't call it nice. It will include setbacks. It will include death. It will include self-doubt. It will include fear. But like Jacob, God will not let go. As Charles Wesley said, Jacob really wrestled love itself, incarnate, the essence of God. And so do we. It is love, not a virus, that we wrestle. Don't let go of love, for that is God. It will move us. It will change us. It will shape us. It will save us. If you haven't seen it in these other medical reflections, listen now to Paul Spearman, another physician whose research puts him on the front line of vaccine development.
Hi, my name is Paul Spearman. I just wanted to say a few words to my friends at Clifton. I am a physician. I work at Cincinnati Children's. I'm also a scientist, and I run a virology lab, so this pandemic has been a whirlwind of activity for many of us here at the hospital. It's difficult for everyone to handle the pandemic with all the uncertainties and the anxieties. One thing that's helped me is the response of the scientific community, the fact that we're making vaccines and we're able to test those vaccines and make new tests and really do things very positively against the virus, to me is reassuring. And I think maybe everyone can get some feeling of satisfaction or comfort out of the fact that you can do what you can do in the pandemic. So for some people, that will be avoiding crowds and avoiding groups is what makes sense to prevent spread. Putting on a mask. We all wear masks here all around the hospital, of course, whenever we're not in our private offices. So anyway, I just want to give a message that things are going well here at the hospital. We're able to treat some of the kids with the virus and also to help develop new therapies and new vaccines against it. Wish everyone a great day.
Jesus said, "Even greater things than I have done, you, O church, will do." When Jacob finally got the one that he was wrestling with to confess who he was, he said to Jacob, "You shall no longer be Jacob, but Israel, for you have striven with God and with humans and have prevailed." In today's context, I say to you, you shall no longer be called church. You shall be called love. You shall no longer be called Christians. You shall be called love. You shall no longer be called by your name. You shall be called love. For you have striven with God in this season and with humans, and you've prevailed. And greater things than Jesus ever did are possible with this, with us. This is the promise of our faithful wrestling with love, that we get to be love in the world. That's the call our medical friends are answering. We cannot say thank you enough for their example. We cannot offer enough commitment to support them in our lives. But it's also a call to each of us in our own local ways, regardless of our skills, training, employment, or relationships. Because the question, will you love me tomorrow, is not a question of God. It's a question of you. Will you love God enough to be love tomorrow? May it be so.